Kaylin Ellsbury looks like a perfectly healthy Zumba instructor. She leads everyone through this Latin dance-inspired workout without missing a beat. But the truth is, Ellsbury is sick. She has cystic fibrosis. The disease causes mucus to build up in her lungs, making her prone to infections that leave her hospitalized every few weeks.
Essentially, I'm spending half my life in the hospital because the mucus secretions in my lungs are so thick and it's just covered in bacteria.
Average lifespan for cystic fibrosis patients is just 41 years. There have been times when Ellsbury didn't think she'd make it through her 20s. But today, at 27, Ellsbury leads an active life despite her disease. She's now a fitness instructor and a personal trainer.
I couldn't always wait for drugs to come through the development pipeline. But what I could do is I could get my body in the best shape possible. And it would hurt. It would be very grueling. I would get a lot of stares, but I knew that I had to walk into a gym and change my life, or my life was going to end very soon.
Ellsbury says she could lead an even more active life if she could get on a new drug called Orkambi. The FDA approved it last month to treat the most common genetic form of cystic fibrosis. Ellsbury knows Orkambi is not a cure, but she hopes the drug could help her spend more of her life outside the hospital.
Instead of being on IVs or in the hospital every 2 months, maybe I can have 3 months. And if I could have 3 months and I continue to be fit and I continue to do all the right things day in, day out, maybe one day I can go 4 months without a hospitalization.
She says with that kind of time, she could take a trip abroad, set new weightlifting goals, and take on more personal training clients.
So that's what the drug means to me, is what can I do in 4 months that I couldn't do in 2?
Orkambi is made by Vertex Pharmaceuticals. They're based in Boston, but research on the drug was done at this Vertex site in San Diego. Across town, there's another cystic fibrosis researcher who's been studying the disease for decades. I asked him what he thinks of this new drug.
It's incredibly, astoundingly expensive. And I think it's too expensive.
Orkambi costs $259,000 for each patient each year, a price Quinton calls outrageous. In the early 80s, Quinton helped identify basic cellular defects in cystic fibrosis. Vertex built on these and other early discoveries to develop Orkambi. Quinton is glad they did, but he says they're now charging too much for it.
I think a number of us feel a little bit betrayed.
Quinton doesn't just study cystic fibrosis, he has cystic fibrosis. For the past few years, he's been on a different Vertex drug called Kalydeco. It targets a less common form of the disease, and it costs even more than Orkambi.
This is the drug. Right? Each of these little pills costs over $400 for Kalydeco. This is about $5,600 in this little tablet.
Quinton says soaring drug prices are not unique to cystic fibrosis. Lots of new drugs targeting small patient populations have been coming out lately with six-figure price tags.
How can we sustain paying these kinds of costs for drugs if we are trying to develop a healthcare medical system that is efficient and takes care of us well? I don't think we can do that.
Vertex would not agree to a taped interview, but a spokesperson told me Orkambi's price is based on 17 years of drug development. He said Vertex will use part of the revenue to fund work on new cystic fibrosis drugs for patients who still don't have any treatments. Of course, patients won't pay for Orkambi out of pocket. They'll get the drug if their health provider decides to cover it. Some patients have already been approved and are now taking the drug. Kaylin Ellsbury has not been so lucky. She's on a state-run program that has so far turned down her request to get on the drug.
The excitement factor is there. It's definitely there. But at the same time, it's been about a month now and I'm still not on it. So I'm trying to keep an even keel about it.
California's Department of Healthcare Services plans to come up with guidelines later this month on whether or not to cover the drug for patients like Ellsbury. Officials say cost will be considered as they craft those guidelines. David Wagner, KPBS News.